Evoxac, also known as Cevimeline, is a medication used to treat symptoms of dry mouth due to Sjogren syndrome, which is a certain immune disease. It belongs to a class of drugs known as cholinergic agonists and works by stimulating certain nerves to increase the amount of saliva you produce. This can make it easier and more comfortable to speak and swallow, providing relief for those experiencing dry mouth symptoms. The typical daily dosage for Evoxac is determined by your doctor and is usually taken 3 times a day. It is best to take Evoxac on an empty stomach, at least 30 minutes before or 2 hours after eating. Be sure to follow your doctor's instructions for the best results. Now, let's talk about the uses and dosage of Evoxac. You should take this medication by mouth as directed by your doctor, usually 3 times daily. The dosage will depend on your medical condition and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. You can continue to drink water or use saliva substitutes as needed for moisture in your mouth. It's important to know that you may start to feel some benefit in 1 to 2 weeks, but it may take up to 6 weeks to feel the full benefit. If your condition lasts or gets worse, be sure to tell your doctor. Some common side effects of Evoxac include sweating, nausea, runny nose, flushing, frequent urge to urinate, dizziness, weakness, diarrhea, and blurred vision. If these effects persist or worsen, it's important to notify your doctor or pharmacist. Evoxac may also cause an increase in tears, which can be beneficial for dry eyes. If runny eyes become a problem, be sure to inform your doctor. It's essential to remember that this medication has been prescribed to you because the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as irregular heartbeat, shakiness, fainting, lung problems, mental/mood changes, or severe stomach/abdominal pain. In rare cases, a serious allergic reaction to Evoxac may occur. Seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, be sure to contact your doctor or pharmacist. Before taking Evoxac, it's important to tell your doctor if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that could cause allergic reactions or other problems. Before using Evoxac, discuss your medical history with your doctor, especially if you have breathing problems, certain eye conditions, heart disease, low or high blood pressure, liver problems, kidney stones, mental/mood disorders, stomach problems, or if you are using alcohol or marijuana. Evoxac may cause dizziness or vision problems, especially at night. It's important to be cautious when driving, using machinery, or doing anything that requires alertness or clear vision, especially at night. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. If Evoxac causes excessive sweating, it's important to drink plenty of fluids to avoid dehydration. If you have trouble drinking enough fluids, contact your doctor right away. Before undergoing surgery, it's important to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Evoxac should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Evoxac, it's important to be aware of potential drug interactions that could affect how it works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Evoxac include beta blockers such as metoprolol and atenolol. Additionally, other medications can affect the removal of Cevimeline from your body, which may impact how Evoxac works. Examples of these medications include cimetidine, amiodarone, ritonavir, fluoxetine, among others. It's essential to discuss any potential drug interactions with your healthcare provider before starting Evoxac, as well as regularly updating them on any new medications you may be prescribed. This will help ensure the safe and effective use of Evoxac for your condition. As always, follow your doctor's recommendations for the best results. If someone has taken too much Evoxac and has serious symptoms like passing out or trouble breathing, it's important to seek medical help immediately. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include extreme sweating, shakiness, slowed or irregular heartbeat, severe breathing problems, confusion, fainting, and stomach or abdominal cramping. This medication is used to treat symptoms of dry mouth caused by a certain immune disease, Sjogren syndrome. It helps to increase the production of saliva, relieving dryness and discomfort. Take this medication by mouth usually 3 times a day, with or without food, or as directed by your doctor. The dosage is based on your medical condition and response to treatment. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It is important to store Evoxac at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to disposing of Evoxac, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. If you are unsure about how to dispose of Evoxac, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.